everyone. I'm glad you could join the webinar. Today we're going to hear about family-driven planning from a rather unusual, if not unique, program in New York State from Hillside agencies that shows how individuals that we had sometimes thought had no relatives or who might be very isolated, how we can in fact build around them and build a circle of support, even if it's very broadly spread, from their relatives and from people who are in their lives that we might not have been able to recognize before. So I'm going to pass over to Dina Adler, who is with Hillside. And Dina, over to you.
Thank you very much. Good afternoon, everybody. I'd like to first start out by saying that I find that the more that I work with young adults, and even we have young children now, in doing our method of family finding and family-driven planning, there's so many successes, and it really begins with the heart. And we're even doing a research project right now, and even finding that while we were hoping for, reduction in Medicaid costs and whatever, the most significant part is to really, it's the qualitative piece by telling the stories, because these, as you all know, are individuals who are often hopeless and lonely and very unconnected. And some of the supports that we've been able to make in the connections not only increase the hope and quality of life for the individuals, it goes out to the family, and then it goes out to their supports. And like a parallel process, it also does for those very incredible people who work in the group homes or work in the day programs with these people, and the hope just gets shared. So I will let you know about our methods in working with circle of support and building connections, and also what do we mean by family finding and what do we mean by family-driven planning. And I'll share with you some of our successes and also some of the barriers and obstacles that we have before us that we've been able to reduce and work with. And I also want you to know that I do this full-time. So I know that when I've spoken to other people, sometimes they feel like, oh, I wish we could do this, or we don't have time. So hopefully there's even some seeds that you can take away from this, some things that you can do, because every bit that everybody does to increase a connection or circle of support for another human being increases quality of life. So you can even see the diagram on this first slide of just the number of people and the importance also of the symbolism of a circle. And that, and just to also let you know that the grant project that we're currently doing, looking at criteria, one of the things that we're focusing on is looking at those who have 3 or less connections. And we find that that's kind of like a red flag marker to know when really we should be focusing a lot more than we have been on increasing and expanding people's circle of supports. Just to let you know, I do work with Michelle Belge in the Institute for Family Connections, and primarily now what we're doing is training and offering the family finding service to those with developmental disabilities and those in the foster care system. The first slide here shows a tool in the beginning stages of which we call discovery. Who is present in this person's life? Sometimes people come with a binder and come with a history, but even if you just sat down with a youth or a young adult and a very simple map, and this is something that anyone can do, we use a square or rectangle for males and a circle for females. And if you look in this diagram, here we have Sam, 19 years old. Who does Sam have in his life? So you can see that we have he's listed a dad and a mom, and we found out there's an aunt and an uncle and a cousin and a sister. The second part of this, if there's been a death, you can make like a broken line. Sometimes that will also note, you can put like your own kind of symbol for someone who's been deceased. And the green line is for who does Sam feel connected to. So in this slide, you can see he chose dad, mom, and a sister. So that's what also tell us he doesn't really know those aunts and uncles and cousins out there. And then the red line is, and who loves you? So just by these kind of color coding and simple diagram, a lot of times you can also involve the people that you're working with in this. This will also, of course, vary when you're working with someone who's nonverbal. So you try to get, a very important person in their life to help do this map with you. In contrast, here is an example of a connectedness map done with, now I have 3 children, 2 in college, 1 graduated. So you can imagine when we start putting this out with aunts and uncles and cousins and people they've had at school and people that they know in the community and coaches and teachers, what a network. So if they should ever move, if someone should die, they are very connected. So this is what our hope is for everybody. Not everybody has a huge family. And when we first began family finding training, which actually originated in Seattle by Kevin Campbell, he would always hope for, get 40 people, find as many as you can. We have found, doing our work, we're not always lucky enough to find 40. And sometimes we find 10, and not to feel by any means disappointed that all we found was 10 people. Sometimes we find 3. Sometimes there's 1 significant person that we've added. So it's always about hope, but we do keep our eyes open to find as many as possible, and in as many different kinds of categories as well. Another type of way to discover who's important is a circle diagram. It also can be called a sociogram. Often what I do is just get out a big piece of paper, get a circle, and start with the person's name in the middle and ask them, who is in your life? Who are you very close to? And we start to jot down those names. And then you can ask, who are not very supportive? And maybe where do you want to put them? Do you want to put them around the middle? Sometimes they want to put them on the other side of the page, and that's okay. The other unique thing about a circle diagram is that it could vary, excuse me, from 1 week to another week, and you can also save it and date it. So it becomes kind of a nice measurement tool, kind of like, a journaling process. And you can also show the person, wow, last month you were upset with mom and you had her on the outside and you worked through some issues. And look how close mom has come to your inner circle. So this is a nice way to also show healthy movement as well. The other thing I would always add as we're working with people on different verbal and nonverbal levels, if they can't write or read, you might use a picture drawing. So let's say Uncle Henry is listed and something that they like to do is go fishing. So maybe you would draw like a fishing pole or a little fish. So always keep that in mind, that you have also pictures and other ways of communication if, writing is not primary. Another tool that you can use is called a mobility map. A mobility map is another way of storytelling. Starting with the person asking, as far back as you can remember, where did you live? Who lived there? And when you're doing this, if you have the ability, you could put up big white paper on a wall. If the person's able to, give them a marker, really let them be engaged in the process. Even if they're not doing the writing, maybe they can make little stick people. They can tell you the color of a house. This isn't necessarily, and I'm an art therapist, it's not an art therapy tool where we're looking for diagnostic information or if we're looking for some symbol that we're concerned about. Now, while that may be information, just keep that to the side, because always, as we're talking about increasing connections and quality of life and hope, there might be some therapeutic issues that come up that are going to be very important. But we can just put that on the side and remember maybe perhaps to deal with that at a later time. So here's an example where somebody, remembered the name of the street, who lived there. Sometimes you'll remember a neighbor. And this is part of discovery tool, because sometimes it might be found that, you know, where they're, let's say, living in a group home now, but where they lived for 10 years, let's say Edna lived next door, and she was a primary support for the family. As the family moves on, Edna might be found. So get as much information you can and see what you can do. Just to give you a little vignette about, I was working with a woman who's 20, and both her parents died. And she started off doing this mobility map and actually drew the house that she grew up in. And not that we discovered any neighbors, but it opened up her heart and her readiness to be willing to go reach out to some other family members that she was disconnected with. Here's a slide of a concept that we really use as an integral part of our work with families, original soil. And for those of you who might be gardeners out there, and here we are in this lovely summer season beginning, and transplanting, when you take that plant, or when you are repotting a plant or a tree, you want those roots and you want some of the soil around it before you transplant it somewhere else. So if you can keep this image in mind and know that as some of the people that we work with perhaps go into group homes or different kinds of centers or even independent living situations, it's so important to bring family with. Let me just say at this point that is, while we're also talking about original soil, one of the barriers that we've come across is that sometimes, and we've all had this as well, even in my own family, family can be difficult. Family can be our own barrier, but families also tend to do a lot more healing and forgiving than sometimes we as providers, and that maybe we get protective, allow them to have. So often in my work, when I will mention finding birth family or people who have been disconnected, what I hear from providers is, well, fear comes up in that, what if this brings up trauma? What if they regress? So what I can also just add at this point in time as well, how important it is to always work collaboratively. So find out who are the necessary people, the family, but as well, who are the important key providers and decision makers, because we always want to go forward with safety and caution. So for example, I have one young man that I'm working with, and he wanted to find his family. And when his advocate, who was actually from the court, found out about this, she felt like, no, this is going to cause regression, this is dangerous territory. We called a meeting, we got the psychiatrist, we got the psychologist, the important people at the group home, and we talked. So we're already now decreasing fear. And then the advocate said, you know, everybody has the right to family. And I use that as a key example, and when I'm with other people who are going through the same part of that process, working through fear and coming to realize we all want to be connected. So I think that's a very important thing to keep in mind. As we're going forward, here's just another kind of visual to kind of keep your scope focused in the right way. Sometimes we have that ace of diamonds. We find that one uncle, or there's one person, and that is a person who, let's say someone's living in a group home, takes him out for Easter dinner, calls him on his birthday. What we want to keep in mind is, if anything should happen, let's say to that ace of diamonds, the connections are lost. So while the ace of diamonds might be a very important key person, always kind of think in mind to go for eight of hearts. The other thing is that what we're finding too is, just as, you know, when you throw a pebble in water and the ripples start rippling out, that if the caregiver is supporting the youth identified or the young adult, they may need support as well. So we have many caregivers that we're working with that are in their late 60s and 70s, and either they've adopted or their child, young adult, has developmental disabilities, and they may need support emotionally, for transportation. So not only are we just looking at building connections and quality of life for our young adult identified, but everybody. And that's where our concept of family-driven planning came from. Here's another, I'm not present with you right now, but if I were, I'd be throwing out Now or Later candies, as hard as they are. But it's become a great candy symbol for what we do. And the emphasis is do it now, don't wait for later. So many of the people that we work with, and that, you know, we see this in all our lives, and I'm sure you could relate as well. When someone dies, we get together for a funeral. Some of the people that I've worked with have missed the opportunity then of that family member that they could have gotten close to. So even now we're trying to really push forward for one of ours to be able to see his grandmother, and going through some hoops and trying to really put forth the idea of not waiting till later, but really do as much as we can now to build the quality of life. When I work with the people in this study that we're doing, we do a connection scale. And at first we're looking at the number of connections that they have and having them rate who's meaningful and what's meaningful to them. And then a second part of it is who helps them and assists them with so many life connections and skills, from cooking to having a home to go to with a family meal weekly or on a holiday, perhaps voting, anything that we might experience in our regular life. And what I'm finding is that those who are living in group homes tend to say staff, 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 staff. Now, staff are incredibly important, and I bless and validate the staff all the time who work in group homes because it's such an important job. But at the same time, we want to look at who are in these people's lives that are not permanent, that are not paid and not staff, so they're also having people who will be there whenever, and not if they leave a job, then they lose them in their life. But I do have to say, because truly the people who work with people with disabilities, I find, are some of the most compassionate. And many we come to and ask them to be on a circle of support. So keep that in mind too, that you may be working with somebody and 10 years previous he was in another group home. Sometimes we find out those staff who work there, they're so happy to re-engage with these young adults and adults, and often say, I'd like to be part of their circle of support. As I'm going to go through this, I'm going to always kind of jump if a vignette comes to mind. And let me just tell you now a little story. I'm working with someone now who just got referred. He doesn't have any family connections right now, but the group home staff know that he has a mother out there and he has a sister that he was separated from in his early teens. His advocate is actually a previous staff member, and she doesn't work in the group home anymore, but she is his court-appointed advocate. So she had to give us permission to do family connections work with. And at first she was very hesitant, thinking, you know, they hurt him back then and I don't want him to have any more pain in life. As we spoke, and she realized that we do not bring in anybody if they're in an unsafe situation in life, she relaxed, and she also said, you know, when he's with me, he looks at me and says, are you my mother? And she said, honestly, she can't say yes. So she'll say, I love you like a mother. And now she's opening her heart to the thinking that maybe he does want to meet his mother and know. So these are just kinds of some things to keep in mind. Also, in your training, you might recognize Maslow's theory. And when you look at this triangle, and at the bottom, how important it is to get your physiological needs met, safety, which we've been talking about, but right there in the middle, belonging and love needs before we can get any further in the growth that's going to come in life. So it's a reminder that just because somebody goes into a group home or somebody has disabilities, it doesn't mean that they would not want to have belonging and love from a family member any less than some of us. As we talk about family finding, I will let you know what the stages of this model is that we do. And another thing that just happened about 2 weeks ago, I was at a staff meeting in a group home talking to them about family connections and talking to them about the circle of support that we're doing. And the manager said, and maybe you are all familiar with this, she said, this relates really well to PALMS, the person outcome measurement. And she was and it was a very young group home staff, and she said, now it might be we're writing in that Debbie should be brushing her teeth, but it might be more our want for her to do this than Debbie. If we ask Debbie what she wants right now, and if Debbie says, I want to be and spend more time with my grandmother, then the manager was saying, so this is what we have to write down as their objective that they want to work towards. So she felt like it was a really good match and a measurement tool because you can document. We've reached out to grandmother. Now she's going once a month to grandmother's house. She's now going with her brother. We've had 2 group homes come together so that they could do a holiday together and go to a restaurant for St. Patrick's Day. So hopefully this is another way that it also impacts the work and the accountability that all of us do. So in the beginning, we're discovering who do we know loves and is connected to this person, both family, friends, past providers. Is there anybody, if there was religious connections in a church or any kind of pastoral connection, any kind of coach, any neighbor, and then we begin to identify and contact them and see if they will become engaged in the person's circle of support. And hopefully you won't think today that, oh my goodness, this is sounding like it's so easy and I should do A, B, and C and it's all going to flow together. And why is it not happening for us? So I want to let you know that this is actually a very difficult process and it has lots of ups and downs. And sometimes, even if we're in a later stage of decision making, all of a sudden another relative I might find out about and we jump back to the discovery stage. So this is definitely a process. And I will go into more detail about some of the search mechanisms. So after you have looked at who's out there and asked if they would be willing to come to a meeting, and sometimes even the meeting's 1 or 2 people, you bring together all the people and you ask, what is the big unmet need? And you try to put that in a statement. Here's the thing about the big unmet need. It's not from the hat or the mindset from a provider. And some of our families, unfortunately, are so trained as us to think as providers, we're always looking for either how to fix something or what do they need. They need medication. They need this skill. They need to go to therapy. The unmet need, if you think back to Maslow's chart, it's really not something that you can buy or necessarily a technique. So most of the unmet need statements that we work with families to work towards is realizing they need love, they need connection. Here's another example. Working with a young fellow who's 24, nonverbal, and he lives with his mother, and he's on a low priority list, even though she's hoping that he will get bumped up to priority 1 because she feels like he's sometimes very aggressive, that living in a group home would be a good next step for him. And unfortunately, his father, her husband died a year and a half ago, and it kind of froze the family. She didn't know how to tell her son anything, because he's nonverbal, about the dad passing. She didn't think at that time it was good for him to go to a funeral. So when I came into the picture and heard this, I was saying that I think it's important to find a way to tell, let's call him Mark, that his dad died. So we kind of used, if you're familiar with social stories, and made a big board, brought out pictures of Dad again. Because remember, from his point of view, Dad was here one day and then not in the house again. And even through that year, some of the pictures have come down. So we used picture symbols, and this was a hard task. So we even used the one like of something dying, but that wouldn't regrow. So we didn't use a tree. So it was like if you picked a flower or a rose, the rose is definitely going to die. We had two picture symbols, hoping that he would get this concept about something that not's going to come back. Some aggression has been decreased, the mom has noticed. She also noticed that we put laminated the board, and he rubs the board. The biggest thing that came out of this was that when we had brought the family together and asked them to write this big unmet need, first they were all concerned about safety and what is their sister-in-law and their sister going to do if something should happen to her. And they also realized Mark needed love and connections again. And when I asked them, what should we do first, even though they so much wanted to go a safety route and to make a plan of action, they realized they needed love and connection. So we did some grief work, because they also hadn't spoken about the death in the family for over a year. By doing that and getting the family members together, the sister-in-law, his aunt, has begun to take him, and without mom, so mom gets a break. So just to let you know, sometimes families have to sit for a bit to figure out what is the need, and allowing them to kind of dialogue with some guidance, they will often recognize it always comes down to love and connection. Sometimes what we'll say is that this person needs to feel loved and supported by family, and sometimes we will add on the second piece, and to live a safe and secure life, because sometimes there are some risk factors that we do need to be aware of. The second piece of this is that they're making a vision of what would make things better for a person, and that becomes the shared vision statement. So that the unmet need, it starts to flow into, now, what can we do so that that love and connection begins to be part of everybody's vision. The next step is having a planning meeting, and sometimes this is the people who work in the group home, sometimes this is also with family members, and whoever our person is, our identified most important person that we're doing the planning with and around. And you review what the big unmet need statement, we sometimes just call this the buns, and also the shared vision statement, and begin to plan. And always at this point, we're thinking about sustainability. How are we going to keep this going, especially as staff come in and out? So that we are always hoping that it's ongoing. I'm going to throw in another little story because I think it's so important, that in the one that I was telling you where the advocate was so afraid to bring in family and said, at first she didn't want that, and then said everybody has the right to family. Because I knew that the staff was very scared, I thought I'm going to work very slowly. So the brother and sister hadn't seen each other for over 23 years. The sister knew she had a brother. The younger brother knew he had family, but he had never met anybody. He was freed for adoption about the age of 5 and just went into the system from group home to foster home after that, until now residing at a group home. And they met on near Valentine's Day. And then in March, I thought, all right, well, I'm going to work with the group homes and see if I can get them together again. And when I made the call, the sister said to me, oh, we're getting together for St. Patrick's Day. And I said, well, who's doing this? bless their hearts, it was the people in the group home that were so excited that family was found. They were not going to let this ball drop. So they have been the greatest resource for ongoing support. And I think what happens is that they're equally as happy, and their quality of life and their work goes up because they see the connectedness. So it's a feel-good all the way around. Let's jump back a bit. For some of these are the things that possibly you might even be able to do. So these are the tools for searching, finding, and engaging. And this is really the first part of it. So sometimes that you have at your access are go to the records and look at them. We're not looking necessarily for psychological history, but sometimes through there we might find he lived for, a couple months with Aunt Donna. So we're finding out places where he might have lived, any names, and starting to use that. Cold calls, and these are sometimes uncomfortable. In the day and age of texting, we do a lot less of this. But sometimes it is calling somebody and saying, I think I work with a relative of yours, giving them not all information for confidentiality, but if you can imagine being on the other end, and sometimes you're getting calls saying, something about your nephew who you might not have seen for 30 years. Sometimes these go very well, and you can just hear the emotion. Sometimes you can hear the hesitancy, and you might say, can I call back in a week? So again, it's a process. Internet searches. In family finding, we do have database searches. It kind of feels like a CSI show that help. Sometimes you can use, we live in Rochester White Pages. It's always amazing still what you can sometimes find. They do have other search mechanisms that you might find on the internet as well. Facebook has become an incredible way to connect. And I actually have one through Hillside, so it keeps me, it's not my private life, so it's, even though it sounds funny that I'm Dina Family Finder, but it is a way for me to connect. When you do find other family members, then you can kind of go into their friends, and then you might realize, oh my goodness, there's other people here that I'm learning about. And for safety and precaution, actually sometimes it can be a tool if we're concerned by anything that we do see on the Facebook page, and that might lead us or guide us to what kind of other resources the supports might need. The other thing about Facebook that can go the other way around is sometimes when family members go look at their found, young adults, the people that we're working with, and they see what's on their Facebook page, they might not want to have that connection. So Facebook can also be detrimental as well, so go forward with caution with that. And the other one, of course, is letters. Sometimes it's also being very creative. So when I mentioned before that it's very sad that oftentimes we get together for funerals, some information can really guide us from funerals. So if we're finding, and we can't seem to find family, oftentimes, though, you go back to the most recent funeral. Let's say the grandfather died, and there they will usually list in the obituary, which is also so easy access online now as well, and it'll say all the family members. For one of the young adults that I'm working with, both her mother and father died, and we were looking for family. She got disconnected for many years and had been in care, both in then foster care and then graduating to a group home. So I knew that the family came from a small town. I sent a letter to the funeral home and to the church that was adjoined to it, and I waited. And about 2 weeks later, of course, every day seems too much for us, but 2 weeks later, I got a call back from the receptionist, and she said, I don't know the family who died, but I know a cousin related to them, and I will call them and give them your information. Sure enough, she called me, and she said, I'm not even lost. I was at so-and-so's graduation, but in the past 3 years, we never got a call from any caseworker, and we lost touch of our cousin. So they were very pleased to be reconnected. And a lot of this work is sometimes, yes, we're finding family that they didn't know about before. Sometimes we've got disconnected. And the other thing to keep in mind is to go forward without judgment and not to say, well, that family member hasn't called in 20 years. Quite honestly, there's many cousins that I have not talked to, I'm sure 30 years or more. So our concept is to always move forward and keep hearts open. These are just examples. go back to the case record review, cold calls. You won't find phone booths often, and it does feel a little funny making calls. Let me just something on this though as well. Sometimes it's not just that we're connecting other people to the ones we're working with, but it's also we're teaching the ones that we work with how to actually connect also to others. So for some, we are having them even draw a postcard to send, how to make a phone call and leave a message. So as you see this whole cold calls, and in our day and age of texting and just Facebook quick messages or tweeting, I don't even do that, it is important to also help the ones that we work with learn how to connect. All the tools that you have that we might not have thought about. So let's go over some of the outcomes. Number one, people have a decrease in loneliness and isolation and have an increase in hope for the future. Many start off with fear. What if you don't find family members? So for some, we're putting together a circle of supports, always thinking out of the box, that if there's no family, then we're putting together past group homework providers, a librarian, a teacher, a neighbor. So always know that pretty much we can always increase somebody's circle of connection. Number two, people have an increased understanding of their families and themselves, including knowing their own story and knowing more about their health history. This young woman who lost both her parents, when we found her cousin in a small town, we went there, and it was important for her to go to the gravesite of her grandparents. She wasn't going to get a chance to meet them again, but that was important to her. The other thing that I'll just say also, sometimes what we give to these people or find are photographs, and that's something that they haven't had before. And I've seen so many people absolutely just treasure the photograph. Let me also let you know, always if you find a photograph, take copies of it, because sometimes these get lost, or if we're upset, sometimes they would get ripped up or ruined. So what we've learned is make copies. 3, people have an increased number and strength of connections with supportive family members, friends, and natural supports. Before, when I first began speaking and I said that for the grant that we're doing and we're looking for 3 or less connections, another important thing to note and to always ask, somebody might say, oh, no, they're connected. Yeah, they went and they saw their family at Easter and Thanksgiving. Well, when you think about it, that's twice a year. So what we're also doing is helping those people be connected in other ways that they might not have thought about. So send a card, send a photograph, maybe go fishing, so that it doesn't just have to be, oh, we better invite them to that family dinner. The other thing is that for the people that we work with that are nonverbal, what we're doing now is focusing a lot more on technology with Skype and tablets. Even if, let's say somebody was living in a group home and the tablet was kept in the staff member's office, that's okay. But when you make a phone call and you're seeing the family member there and you're seeing the smile on their face, that's absolutely going to make the difference. One other little story is we have worked with someone who was disconnected from an uncle for about 20 years. And when one of our providers called him, he was so happy to be reconnected. Of course, he felt badly. And we have to recognize, too, that on their end, they experience a lot of shame as well and guilt for not being connected. And we try just to always use the premise of moving forward. But at the group home, he noticed that on the bulletin board where the phone was, there was the uncle's number. So the people in the group home were not calling as well. So sometimes what we're doing is we're also reminding and giving assistance to what that phone call could look like. So if someone's more on the nonverbal level, but if a staff member makes a call, let's say to that uncle who he was living in Florida, and just starts a conversation, oh, let me tell you, your niece went to a baseball game this week. The uncle could then say, oh, and did she get a snack at the game? And the staff member might say, yes, yes, we remember we got a hot dog. And all of a sudden, stories are being told. And what you can look for is how the facial affect is also changing. Number 4, people have an increased quality of care and quality of life with the involvement and input of family, friends, and natural supports. Here's another example of just all that can happen from just increasing supports. Actually, the brother and sister that were, the sister was raised by the great-grandmother who's now passed. She always remembered she had a younger brother. Now has his aunt. What we found was, and we took an interpreter with us. Make a pause right now. Sorry for the interruption. Are we okay to go ahead?
Can you hear me?
Yeah, I can hear you.
Okay, so I think that the slide beginning outcomes of family-driven planning, number 4.
Yeah.
We should probably resume right there again, and then okay. Carol can edit out the, because your voice was breaking up for a bit. I think there was maybe a lost connection.
Okay. 3. People have an increased number and strength of connections with supportive family members, friends, and natural supports. I'm going to use this slide and the next slide just to leave you with this, because it was really an incredible story that happened, and this is the one with the brother and sister that were separated when he was age 3 and she was age 6. So she remembered that she had a brother. He figured he had family, and a couple of years ago family finding was begun with him, and he had the search that we had found. He carried around those papers knowing this is my family. He had never even met any of them. Just having the list and their names, he knew someday he could be connected with these people out there. On the sister's end, she knew, I have a brother out there and I want to find him. When we made the call, and it just became so easy because she knew he was out there and he knew that he had family, and we got them to. Part of this was introducing her and aunt. So when we went to the family and introduced her brother to now his aunt and his grandmother that he had never met before, remembered, they began to tear, and they said how much he looked like the father and that they remembered when he was born. And this is very difficult, and at the same time so incredibly happy as well. They're just, you know, Oprah moments as what I call them. Something else that we found, and I'll lead this into the next slide, people have an increased quality of care and quality of life with the involvement and input of family, friends, and natural supports. I come back to those two words, involvement and input, because I realized working with this family, they were from Puerto Rico and their primary language was Spanish, that when they would go to service plan meetings at the group home, no one there was Spanish speaking. So they don't understand the medication that she's on. They don't understand what are her goals and objectives. So when you open up circle of supports, you also recognize what are all the needs of everybody. So going forward, we will work with the group home to have a Spanish-speaking translator interpreter there. So that will increase the involvement and the input of the family. So when we're talking about hope and quality of care, on so many levels, this is really about advocacy for absolutely all members involved. And number 5, families experience healing and restoration through reconnection with their family members. I've told you some stories about people finding family. I've told you stories about who are asking about that they know family members out there and they hope to connect. I've told you stories about how even with some that are nonverbal, how the other family members do some reconnection, which then trickle down to help the identified person as well. I want to leave you with one story who's probably the one that we have worked with the most disabilities, because there's also not only developmental, intellectual, but also physical disabilities. Sometimes it's those where that's the most hopeless, and that we might say that, well, they're lucky to be in a group home, and the staff so much becomes that family for that person. And while that's important, there's still family out there. So we did a search, and we found the father. He was actually homeless. We found him, and when one of our providers reached out to him, he said, I haven't seen my daughter in probably, it's well over 10 years. He said, but you know, when she was little, he would always keep Skittles in his pocket, and she would reach forward and get the Skittle, and she would eat it. That was the extent of their relationship and their level of communication. When our provider was bringing the father out to see his daughter in the group home, the father said, I've got some Skittles in my pocket. Here's the wonderful moment. When they went into the group home, and there was the father, and he sat beside his daughter that he hadn't seen for over a decade, she reached over to his pocket and took a Skittle. In the scheme of things, does that reduce Medicaid cost? In the scheme of things, is that major research or development? No, perhaps not. But that moment for that girl and that father was extraordinary. So I hope I leave you with that thought, that anything you can do to reconnect and increase people's circle of support is probably one of the most humbling, meaningful ways of working that I could possibly think of in this world. Some of the outcomes that we do find, though, and of course that's what we're even doing in our grant, is that we are bringing together various agencies and working in alignment with all goals and values together. And what we're doing maybe in one area is also going to increase the work in another part of that person's life, whether that's at their day hab, at the group home, or in the family itself. There may be some cost savings. Some of the things that we're trying to also look at is some of the people have said that more often when they're, like I'll speak about one in particular, when she goes to see her grandmother and she comes home, or her mother, she's less aggressive. That means what we can track is less 911 calls. Another group home said that she's happier when she's with her family, and they've tracked, as one of the objectives on her ISP was less aggression and outbursts. And happily, in the last 3 months, they were able to say she hadn't had any aggressive outbursts. That may mean less money for a one-to-one. So hopefully there is some tie, and for even future grant or research work, that Medicaid will also see that there are some outcomes worthy from doing this work. We've talked about this, but it will just kind of end as we're coming to the close. So think about this. Is the person lonely? Does the person want to know more about their family, or want to know more about their story? How often does a person have visitors, and what kind of visit are they having? Do they go to a person's home? Do they get to go out fishing with a favorite uncle to a family spot? Does a person live some distance away? And how can we bring in other people to support that? And I'm also very thankful to some of these group home members that I've worked with that will share the distance and meet halfway. So it's thinking out of the box and also being very creative. And again, thinking about, are the people that we work with having contact besides paid professionals as beautiful and as needed as they are? I'm going to skip over this part. This was kind of a little rhyme that we came up with to just encourage people to do it. But I have a feeling that the people that I'm speaking to right now are very encouraged and probably leaving with very big open hearts and wanting to see what they can do with connections. So we thank you, and please feel free to contact us with any questions, any parts of the model that you might be able to incorporate in your work. I am Dina Adler at hillside.com, and I'll leave you with my phone number. It is 585-356-0368. And if you do some family connection work and you have a beautiful story to share, I'd be happy to hear it. Thank you.